I spoke to you about the Indian variant of SARS-CoV-2 around 2 weeks ago, and this is an update with the knowledge that has come following this. In the first talk, I told you about the different mutations that are noted in the Indian variant, and it is called the Indian variant because it was first detected in India, but it has spread to many parts of the world. So these are the 8 mutations that are found in the spike gene that codes for the spike protein, and there are 2 important mutations, as I would have shown there, in the receptor binding domain, and I've discussed this in the previous video, and though that was the reason they call this the double variant. Now in the UK, there are 3 subvariants, that is the 6171, 2, and 3. All these were reported in the UK in April, and as at the 12th of May, you can see that there are 5 variants of concern and 7 variants of interest in the UK. Of the 5 variants of concern, you can see the subvariant 2 of the Indian variant is also listed as a variant of concern. This slide shows the number of cases of the different variants since October. And you can immediately see that the subvariant 2, Indian subvariant 2, has the highest number of cases, that's more than 1,000, and 1 and 3 have other cases, but 3 is the least. So the number 2 subvariant is the one that is increasing rapidly. And this is again shown in this figure, where you can see in the green line, the subvariant 2, the Indian variant growth rate being very rapid compared to the other variants listed in the graph, such as the South African and the Brazilian variant. Again, it is shown in this graph too, where the line at the upper end of the curve that's in green is the rate of growth of the subvariant 2 of the Indian variant. So the question comes in, would the Indian variant affect the UK's reopening plans? We know that yesterday, May 17, there was a further relaxation of some of the plans. And then in June, there was supposed to be a complete relaxation of the restrictions that were in place. This is despite more than 50% having had at least 1 dose of vaccine and a number of people having had both doses of the vaccine. The areas where the proportion of the cases being quite high with regards to Indian variant is shown in this figure, and you can see certain parts of London, Bolton, etc. has high number of cases, high number of samples being positive for the Indian variant. And the important thing to remember is that the vast majority of Indian variant patients in hospital in Bolton hadn't taken up the COVID-19 vaccine. They had been offered the vaccine and they had refused the vaccine, or some had just not taken it. And that is an important area to be focused on with regards to the spread of this variant. So what do we know about this variant? It's significantly more transmissible than the current strain. Realistic possibility that is as much as 50% more transmissible. At the present time, there's no evidence to say that it leads to more severe disease or that it evades vaccines. That's at the present time. Most studies are ongoing. So this is a figure showing the modeling with regards to the transmissibility and the lockdown measures being reduced in the UK. If the transmissibility is about 50%, there could potentially be up to 5,000 more hospital admissions. And this is what is troubling the authorities, because there can be another surge with regards to this variant being more transmissible and more people getting the condition. So surge testing is in place in a number of places to combat the rise. And vaccines have been accelerated. Vaccine rollout has been accelerated. That is, those over the age of 50 would get the vaccine now in 8 weeks rather than 10 to 12 weeks. And again, this applies to clinically vulnerable people. The idea is to prevent disease. As I told you, the important thing is to prevent severe disease, hospitalization, and death in this group of patients. And if you have higher neutralizing antibodies and T cells, the chance of doing this would be better, especially in the areas that have been affected. So let us consider some studies that have come out with regards to Indian variant. I'll go through these to give you a flavor of what is known so far. Initially, there was a German study that showed that it entered the lung and the intestinal cells, increased efficacy. It was blocked by certain agents as given in the slide, but it was not blocked by an important monoclonal antibody. And it partially evaded neutralizing antibodies post-infection after Pfizer vaccine. This was an early study, the first study. Then the Cambridge group came and said that it moderately reduced sensitivity in the Pfizer vaccine cohort, but the reduction in magnitude was similar if there was a loss of either of the important mutation, that is L452 and the E484Q. So if they were separately, they were reducing some of the sensitivity. When they were together, there was no additional reduction in sensitivity. That was the take-home message from that study. Next, we have the group in Atlanta who also did studies and found a 6.8-fold reduction in neutralization by antibodies. However, there was considerable effectiveness in neutralization of the Indian subvariant 1 in 79% of people who had recovered from COVID and 100% of vaccinated sera. So it is reducing the neutralization, but still the vaccines were effective. And that's the important thing. It's still, the reduction does not go below the threshold of effectiveness. Again, you know that in the in Oxford, they did a study, and this was just released recently, where vaccines are nearly as effective as against the Indian variant, and 97% effectiveness against the Indian variant was shown in the study, and this was done at the University of Oxford. It was a laboratory study, and we are awaiting the data to be formally published, and it was found that it was equivalent, that is, it is less resistant to vaccine than the South African variant, and it is more similar to the Kent or the Brazilian variant. There was also an observational study from Delhi where they looked at some healthcare workers who received the Covishield vaccine, and they were tested for SARS-CoV-2. 85% had the infection. 65 of those people had been fully vaccinated, but the important thing was hospitalization was very, very low in this group. And that is an important message to again highlight that vaccination reduces the severity of the condition, hospitalization, death, and ITU admission. The study, there were some issues with the study because there was no control group, and we do not know how many of these healthcare workers got the Indian variant as the positive strain. So an important message to remember is that the Indian variant, the number of cases has increased rapidly in the UK in the past few days. And this may affect the lockdown timetable in the UK, and it is important across the world as the transmissibility is higher in this variant. So in summary, what we know at the present time is that the Indian variant has 3 subvariants. The number 2 subvariant is the one that appears to be increasing rapidly in the UK and in several other parts of the world. It's significantly more transmissible than the current strain. And there's a realistic possibility that it's 50% more transmissible. At present, there's no evidence that it is to say that it causes more severe disease or it leads to vaccine ineffectiveness or evades vaccines, because the studies are showing that vaccines are effective. But more studies would be forthcoming. Thanks a lot. Thank you.